everyone, and welcome back to my YouTube channel, The Ladies Guide. I'm Deanna Tikhonov and I'm a women's health nurse practitioner. And on today's episode, I'm going to be talking to you guys about the hormonal implant for the birth control series. So the hormonal implant is something that is about the size of a matchstick, very small and skinny, really like the size of a matchstick, and is something that goes right under the skin in the upper arm area, usually right around here in this general area. It's something that is 99% effective against pregnancy, and it's effective for up to 3 years. So this, like the IUD that I mentioned in one of my last videos, it is something that is known as the set it and forget it method, because once it's inserted in the office, there's nothing you need to remember to take every day, to go in for any appointment. You have it in and it's good for up to 3 years, and then it's removed. At that time, if you loved it, you can have it removed and a new one inserted actually in the same spot to help protect you against pregnancy if that isn't in your plan. So like with all methods, there's always pros and cons and risks and benefits, and each one of you guys has your own unique story. So it is important that you discuss your personal situation with your provider in person, but this is a great way to gain some information and empower you to have that discussion with your provider. So like I always say, this does not replace seeing a provider in person to discuss if this particular method is right for you, but it gives you some more information and education to help decide for yourself if this is something that you're open to and interested in. So I am not going to be saying the actual name of the implant. There is only one right now though on the market in the US. I have no affiliation whatsoever with any medications, any pharmaceutical companies, but it is known as the subdermal hormonal implant, or hormonal implant that goes underneath the skin. So probably have a lot of questions if you don't know much about this, or maybe you've heard something from a friend or a sister about how the implant is and how the procedure was. So first off, candidates for the implant is almost usually everyone, unless you have a history, a personal history of any kind of cancer, any kind of liver disease, whether you have a benign tumor or of course a cancerous tumor in the liver. These are reasons why then the implant would not be a good option for you, mainly because we don't want to add any additional hormones to your body if you have one of these conditions. So those are the big ones that usually are a contraindication to using the implant, but majority of healthy women can use the implant without any kind of medical contraindication. So why would you choose an implant over other methods? So first off, its effectiveness and the fact that it's good for up to 3 years is usually a nice feature for most women. They don't have to do much work on their end and they have this in for the 3 years. The other thing that sometimes women sway between the IUD and the implant, and they pick the implant that goes in the arm rather than the IUD, is because it can come off a little easier of a process to have something that's put inside the arm versus something that goes inside the uterus, although it's truly a personal preference that both can be used and both can be done in the office without much discomfort, but it's something that kind of helps women decide. Some women hear the idea of putting an implant in the arm and it kind of freaks them out, and vice versa when it comes to the IUD and the implant. So it's truly just personal choice when it comes to that. So the procedure itself is something that's done in the office, and what is done is a little mark is made on the skin with a marker to determine where the provider is going to put in the implant, and then they clean off the area with some, usually iodine. It depends if you're allergic to iodine or shellfish, they might use a different cleaning solution. They clean off the skin here, and then they numb the area with a little numbing medication that's injected underneath the skin. So this is the part where you will feel some pinch from the needle and some burning as the medication goes in. However, within a few minutes, this area is numbed. Not your entire arm. Your arm does not get put to sleep, but just this area where the implant is going to go is numb, so that when the implant is inserted, you don't feel anything. And when the numbing medication is used, which it always is part of the protocol, my patients always say, oh, that was it? So it really does a good job. It's done just right underneath the skin. So once that numbing medication is in for a minute or two, then the implant is inserted. So the implant itself is within a needle, and the needle goes underneath the skin in the area that now has been numbed, and a little button is pressed that the provider presses that withdraws the needle and keeps the implant underneath the skin. And that's it. There's a small puncture wound that is there from where the needle went in, and that will heal up very nicely. It's very small incision that will just get covered with a little special band-aid, usually in the office, so you don't need any kind of stitches after it's inserted. So the band-aid goes over. They usually put some gauze and an ACE wrap around it because some women can experience some bruising, so the wrap around the arm helps minimize bruising to that area. So that's really how the procedure is. The insertion itself is about 1 minute of time, but the preparation and of course counseling you, making sure that you are a right candidate and that you have any questions, things like that, that always takes some time. So, prepare to be there for at least 15 to 20 minutes, but the insertion itself is very quick. So after you're done with the procedure, there's no official follow-up that's usually done. It's just that when you check in every year for your annual exam, you kind of check in and see how you're doing with the implant, if you have any issues or side effects. But other than that, there's no kind of surveillance that's really needed. Once it's inserted, it is very important that you and the provider tap and kind of touch and feel that the implant is there. Very important to do that to make sure that there wasn't a malfunction with when it was inserted, that the implant didn't actually come out of the needle. So that's something that's routinely done as well, where the provider and you will kind of feel here. So it is something that if you tapped on your arm, you would be able to feel it, but on a regular daily basis, when you're moving around your arms, it's not something you're going to be feeling 24/7. So that is how the procedure works. Now, what are the side effects? So as with all medications, there are always side effects, and every woman will react differently of how the side effects affect you. So with the implant, a third of women will continue to have regular periods every month. A third of women will stop bleeding completely and no longer have periods. The last third of women can experience irregular bleeding, where you are bleeding on and off kind of randomly, unpredictably, not really able to determine when you're going to have your next period because it's kind of all over the place. That's usually the category of women that do not enjoy this method and end up getting it removed. And unfortunately, there's no way to really determine if you are going to experience this or not until you have it put in. And generally, I always recommend committing to at least 6 months with this method because it is normal in the first 6 months to experience some irregular bleeding on and off. And this is more your body adjusting to the method. But if after 6 months you're still experiencing irregular bleeding, then, if it's affecting your life and really stressing you out, then it might be a reason that you want it removed. Sometimes, if you go in and tell your provider this, they may put you on a birth control pill to help regulate the bleeding. I know it sounds kind of weird of why would you use 2 birth control methods for this if you already have one, but sometimes the birth control pill can help reduce the amount of bleeding you're having. The issue with that is, one, of course, if it's not safe for you to take the birth control pill, the traditional birth control pill with the combined hormones in the pill, then this might not be an option for you. And it's something that we can only use for a few months of time. So sometimes after stopping the pill, it might work initially and then your bleeding might return. So that's the downside. But usually the women who are either getting their period regularly every month or stop bleeding altogether usually are pretty happy because at least they have some predictability and know which category they're in, to not have any surprises of this irregular bleeding on and off at random. So that's really important that you really think about those different side effects and how it may affect you, because when you're mentally prepared that you're going to experience irregular bleeding for the first 6 months and kind of give it a fair shot, and see how your body adjusts after that time, usually women will do fairly well with it. But I find, especially if you weren't really counseled on the potential side effects and then you start irregularly bleeding all the time, that can be very upsetting when no one's really explained that to you. So it's important, and even I have sometimes you were explained, but you might think, oh, that's not gonna happen to me, I'll be fine. And then 2 months in, you're like, get this thing out of me. It happens. And ultimately, it's your body. So absolutely, if you really are unhappy with a method, ones that are inserted, you can always get them out. However, it is important to just understand the potential side effects and how long it might take for your body to adjust, to really give it a fair shot, because sometimes after that 6-month mark, things get better and you're happy with it, and then you realize, okay, it was good that I stuck it out because things kind of calmed down and regulated themselves. It is safe to not get a period with the implant. I get that question a lot. Like I mentioned in the other video with IUDs, some of the IUDs can also take away your period, and that's okay. As long as you're on a method that's taking away your period as a known side effect, that's different than not getting a period at all and not being on a birth control method. So that's something to consider. Some women love the idea of potentially not getting a period, and this may be a reason why they want to consider the implant. However, I just want to stress that there's 3 different ways this can go for you. So it's important to not just focus on the no bleeding potential and understand that you might not react that way, and that make sure you're okay with that. Mentally, that you'll be okay if that was to occur for you. So those are the main side effects really with the implant. Has to do a lot with the bleeding. Every now and then I do have patients that tell me that they did gain weight on the implant, and it is the same hormone as the hormonal injection, which I'll talk about in a future video. So there may be a connection. There hasn't been any proven that absolutely you will gain weight on the implant, and like I've discussed before and in many of my other videos, weight gain usually has many different factors of why weight gain is occurring if you're on birth control as well. It's usually not just the birth control. It could be a lot of different factors: how old you are, your eating habits, your physical activity, your stress level, huge, your sleep patterns, how much sleep you're getting. All those things definitely impact your weight as well. Sometimes if those components are out of whack and then you add hormones in, that kind of makes you more susceptible for weight gain. So absolutely, I do see it, and if you experience that and want it removed, completely understand. But it is a small percentage of women that I see that in with weight gain. Sometimes mood, with all hormonal birth control methods, I'm sure there's women out there watching this video that have experienced that their mood feels worse, that they feel low, that their PMS symptoms have worsened, and women can react differently depending on the birth control method they pick. Some actually help and some might make it worse. So absolutely, mood, we never mess around with that. If you are feeling low and not like yourself, please make sure you talk with your healthcare provider about that and discuss if it's something that the implant is potentially the reason, and if that needs to be removed. So definitely not something to just live with and deal with and be told that it's normal with the implant, because we never want you to feel that your mood is lower and have that kind of risk going on. So very important. Unlikely, I don't see that often, but it's just something that definitely, if you notice that within yourself, definitely reach out to your healthcare provider and discuss that further. So that is the implant. Again, it goes in the arm here, 99% effective, and effective for up to 3 years in the US. And it's just one rod. In other countries, they might look slightly different, but right now in the US, we only have one, and it's one rod that goes underneath the arm, under the skin in the arm. So I hope you enjoyed this video. Please don't forget to comment below, like and subscribe to my channel. Check out my Instagram. It's @_theladiesguide. I go through a lot of different information on there as well, kind of breaking down the stuff that I talk about in each video throughout the week. So definitely check that out as well. I love interacting with you all. I appreciate you all so much. Thank you for watching and looking forward to my next video.